is Larissa Talavera, and I'm here to explain to you how massage therapy is not just for relaxation, but a medical necessity. Sciatica, carpal tunnel, tendinitis, fibromyalgia, and chronic migraines. These are just some of the conditions that I treat on a daily basis. Now you may ask, what do I do? Am I a doctor? No, I am not a doctor. However, I am a medical massage therapist. And as a medical massage therapist, I act as a clinician, which means I put patients on treatment plans, I do patient follow-ups, and I physically address and treat an array of conditions that most people may not realize can be alleviated and cured with massage therapy. Let's take migraines, for example. Have you ever had a migraine? Do you know someone who has had a migraine? What is a migraine exactly? Now, before we can answer those questions, let's first establish what a migraine is not. A migraine is not a really bad headache. A migraine is actually a collection of neurological impulse attacks that affect one or both sides of the head. Attacks usually last between 4 and 72 hours and are accompanied by visual disturbances, nausea or vomiting, dizziness, and numbness and tingling in the side of the face or the arms. According to the Migraine Research Foundation, migraines are one of the world's most disabling medical illnesses. And amazingly, over 10% of the population, including children, are affected by migraines. And every 10 seconds, someone goes to the emergency room with a migraine. Now, how do we combat this? How do we fix this? Prescription pain medications and over-the-counter medications don't always work. My patients come to me so oversaturated with medication that the medication is ineffective because their body has built up a certain tolerance to the medication. So either they have to increase their dosage or they have to find an alternative treatment. And that's where I come in. Massage therapy is the manipulation of the body's soft tissues in order to increase circulation and flow throughout the circulatory system and the lymphatic system. Now, usually when you have pain, regardless of the area, whether it's your head, your neck, your shoulders, it's usually due to a lack of circulation. And as you see here, no flow equals pain, flow equals no pain. So I'm actually going to show you some flow increasing techniques, especially a self-massage technique that I like to use on myself when I have migraine. So if I could get a volunteer, that would be great. Okay, thank you. Go ahead and have you put your face here. So go ahead and grab your arm, drop your head, excuse me. And you're gonna actually put your thumbs right at your suboccipitals. Your suboccipitals are located at the base of the skull and the top of the neck, okay? So you're gonna go ahead and press firmly in the suboccipital area. And usually you'll feel a tender area either behind the ear or behind the eye. When you find that tender area, go ahead and press firmly on that area. Deep breath. Good. Increments of 2 to 3 minutes, and you'll feel your thumbs just sinking into the suboccipitals. Okay, and this really helps when you have a migraine. Okay, go ahead and relax. The second technique is trigger point therapy. Now, trigger point therapy deals in referred pain, which means, for example, if I feel pain here, it's usually coming from here. Or if I feel pain here, it's usually coming from here. Trigger point therapy is used only for professionals. So I would not recommend you do trigger point therapy on yourself because there's so many nerve endings in certain areas. You don't want to cause a pinched nerve or any other issues. You don't want to exacerbate the pain, okay? So basically, I'm going to find a trigger on him, and and I'm going to press firmly. Trigger points are very, very tender spots. So I would usually have my patients breathe in deeply and allow my thumbs to sink into these trigger points. And this is very, very crucial at alleviating migraines. It helps a lot, okay? And again. And usually when I'm doing trigger point therapy, I like to hit multiple triggers at one time. So I could even come here, press here, even pressing here, and even pressing here. And at this point, you usually see their hands tingling, you usually see their hands moving a little bit because they're starting to feel a tingling sensation in their arms, and that's a good thing. That means the circulation is starting to go past those pain points, okay? So we'll go ahead and give him a break. Thank you very much. Alrighty. So although we can recognize that pain is obviously a common thing, we have to understand that pain is usually a sign of an abnormality. So the best way to treat pain is to physically address it, okay? Befriend a massage therapist. Know a massage therapist. Learn about massage therapy. I recommend it because you never know when you'll actually need to use it. And again, it's not just for relaxation, but a medical necessity. Thank you very much.